How many of you have heard of thoracic outlet syndrome, or you've been diagnosed with thoracic outlet syndrome? This is also abbreviated TOS. And so what that is compression of the neurovascular bundle that comes out on either side of the neck that goes down behind the collarbones and goes down into our upper extremities. And so this is a very common condition. Initially, it was a very misdiagnosed condition or underdiagnosed condition. Especially early in my career when patients would come in, they'd say, well, been diagnosed with carpal tunnel syndrome, and they wear the carpal tunnel braces and all this stuff, and it doesn't really help. And then I've also had patients come in and say, well, I've got 2 bulging discs in my cervical spine, and that's causing the issues in my hand. And you do cervical spine testing on them, and none of that provocates pain or the symptoms that they've been experiencing. And so basically the nerves that come out, that's called a brachial plexus. And so from C5 all the way down to T1, so C5, 6, 7, 8, and T1 comes out on each side of our cervical spine and goes behind our collarbones or clavicles and goes down into our upper extremities, which at the hand turns into the median nerve, that's your carpal tunnel nerve on this side, the ulnar nerve, that's your funny bone nerve on this side, and the radial nerve on the back side of the hand. And so this can become compressed for several reasons. One of the reasons can be the anterior scalene muscle can become tight. And so this skeleton would be me looking right at you. So the anterior scalene is this part right here on the front. And so this can become tight and clamp down the nerves. Also, it can be from the pec minor can be tight, and it can pull up and elevate ribs or depress the scapula and all these types of things. So any of those things can cause compression here, and that will clamp down the nerves and or the subclavian artery. So one of the tests that we do for this, or several of the tests that we do for this, we're checking for the radial pulse. So I find your radial pulse, and then I have you move your upper extremity, or I passively move your upper extremity in certain positions and your head and neck in certain positions, and I'm trying to see if your pulse diminishes, so your radial pulse goes away. That could be an indication that you're having compression of the subclavian artery in this area. And then there's also tests that we do for neurogenic to see if it's nerve tissue involved as well. And then let's say that it is. Let's say yes, we go through this and we find, yes, you do have compression in the thoracic outlet area, this interscalene area over here. Yes, there's some compression there. What do we need to do? What treatments do you do for that? So we do corrective exercises. There are stretches that we do both in clinic and we have you do at home. Motor control activities and things that we have you do with the muscles to try to kind of get everything back in a good rhythm. And then also soft tissue work, so manual therapy, massage, maybe you need some joint mobilization work, things like that, to try to correct that. And it is a very correctable thing as long as it's diagnosed correctly. Again, a lot of times these people come in, they've been diagnosed with a cervical neck issue or the carpal tunnel, and they're wearing a carpal tunnel brace, and it doesn't help because, as we know, carpal tunnel does not affect the entire hand. It's only the thumb, the index, the middle finger, this portion of the ring finger, and this side of the hand over here. It does not affect the back side of the hand. That's a separate nerve. And then here on the pinky finger side, that's the ulnar nerve. So, the chances of someone coming in and their entire hand having these issues would be highly unlikely that they have an ulnar nerve issue, a radial nerve issue, and a median nerve issue. It just makes sense that it would be higher up the electrical circuit, perhaps either in the cervical spine or over here in this thoracic outlet area that could be causing the issue. It's more common in overhead athletes, so baseball pitchers, swimmers, people that throw javelin, things like that, anything that's overhead. And then as far as like people with their occupations or their work duties, maybe an electrician, someone that's working overhead, a construction person, even clerical workers, anybody that has their arms in this position for very prolonged periods of time. I've had dental assistants and dental hygienists that have their arms out like this, and so that forward movement, everything coming forwards, that will close off the thoracic outlet area and compress these nerves and or the vessels. And so again, it is very treatable if it's diagnosed correctly, and I have a whole host of tests that we do to try to rule out or rule in if you are having thoracic outlet syndrome. And then I also have videos on my website, ChadGOrthoOT.com, that goes through some of the tests that we do and kind of demonstrate that. So some stuff that you could actually check yourself at home to try to see, if you may have that going on. So, but if you think you do, make sure you talk to your primary health care provider about that. Hope you enjoyed the video. Please make sure that you hit the like and subscribe button to continue watching all my educational videos and tips for therapy and rehab purposes.